CPR can be exhausting, but with technology, it doesn't have to be. A 911 call comes in. Your department is dispatched out to a cardiac arrest victim. Your first thought is, I'm going to be performing CPR. You read the 2012 12th edition of Emergency Care states compressions must not have any interruptions over 10 seconds. And there must be 4 persons rotating the compressions to prevent rescuer fatigue. This can be challenging, especially when you're loading a patient in and out of the rescue vehicle. With the Lucas II compression system, the compressions are continuous. There are no interruptions. When someone is having a heart attack, every second counts. And the Lucas II device is capable of providing that timely care, that important step in there where you don't have to stop. There are no interruptions. I am actively involved in the medical field. In addition to being an EMT, I'm also studying to be a surgical technologist. Every rescue department should consider applying for the Lucas II compression system. Today I'm going to talk about the advantages of the Lucas II and present some information on how you can apply for one for your department. First, I will provide some information on the ease and convenience of the device. This is Lucas II right here. And this bottom part snaps off, which you put under the back area, and then you just take the top piece and you put down, and then you adjust the compression thing down on the person. The Lucas II system provides continuous compressions throughout without interruptions, which is critically important. As stated in the online website, lucas-cpr.com, last updated September 1st, 2013, the Lucas system provides chest compressions in accordance with the latest scientific guidelines, making it an efficient means to alternate the manual CPR. It is very reliable. It provides 100 compressions per minute with a depth of 2 inches for adults. And once turned on, it's continuous. You do not have any interruptions in your compressions. Because it is compressing the chest for you, you can focus on meeting more of your patient's needs. According to the October 15, 2013 article on the online website, nprnews.org, by strapping a portable CPR machine on a cardiac arrest victim, the paramedic's hands were left free. So that paramedic was able to start IVs, and he was able to, he saved time, and they were able to get to the hospital because he didn't have to worry about doing those compressions. The Lucas II system was left on and kept pumping. The doctors actually performed surgery to remove a blood clot while the system was running. In all, the patient received 2 hours and 45 minutes of continuous CPR that would not have been possible if you did it with the standard CPR. The Lucas device did the compressions while the doctor operated, saving this person's life. Now, I will continue by comparing the Lucas II compression system's effectiveness to standard CPR. With continuous compressions, blood is kept circulating, therefore delivering oxygen to organs at all times. Once this is put down, then you start to push the start button and the compression start. According to the lucascpr.com site, which I mentioned earlier, at 6 months, 8.5% of patients treated with the Lucas were alive and in good neurological outcomes compared to 7.6% with standard CPR. It compresses and lifts the chest, increasing the patient's blood pressure and helping the tissues work better. The lifting of the chest does not occur with your standard manual CPR. With the Lucas compression, once the suction cup comes down, it pulls the chest back, and that is what makes the blood circulate and keep going to the organs. Because this device does a better job of maintaining the circulation, statistics show better survival rates are associated with the Lucas II system. Now that you know how effective this system can be, I will inform your department about a grant so you can apply for your own Lucas II compression device. The available grant will help provide more EMS services in hospitals with resources to improve cardiac care. As stated in the April 15, 2015 news release on the online website ehhs.nebraska.gov, Nebraska received a grant of almost $6 million from the Leona and Harry Hemsley Charitable Trust to produce life-saving equipment for ambulances and hospitals, so cardiac care could be improved. Because of this grant, 360 ambulances and 60 hospitals in Nebraska will benefit from this grant. Because this healthcare system will benefit their healthcare system by receiving the Physio Control Lucas II compression device. The Department of Health and Human Services Emergency Medical System Services Program will help coordinate purchase and distribution of these devices. All you have to do is apply. It's the only thing you have to do is apply for this device. They will be given out over a 3-year period, giving you time to research the needs of your department to see if this will benefit you or not. The appropriate training for the device will also be given by the Department of Health and Human Services at no cost to your department. So there will be no cost for the system, and there's no cost for the training. So it's a no-win situation. I feel I have provided sufficient information pertaining to why your department can benefit from an automatic compression system. In conclusion, every rescue department should consider applying for the Lucas II compression system. It is lightweight, it's easy to use, it provides better results than standard CPR, and it can be obtained through a grant. I encourage you to apply for this grant. With the information I have provided, how can you go wrong? Thank you.